Booster shots or third dose of corona vaccine? Things you should know. To boost or not to boost? To take the third vaccine shot or not? That is the question facing countries which are fortunate enough to have vaccinated most of their adult population. In the face of soaring infection numbers caused by the highly contagious Delta variant of SARS-CoV-2 and hints that immunity triggered by COVID-19 vaccines might fade over time, some countries are considering whether to give further doses to those who have been fully vaccinated. Germany and Israel have announced plans for booster shot programs, and a growing list of countries, including the United Arab Emirates, China, India, and Russia, have already started administering extra doses. What is a COVID-19 vaccine booster? Booster vaccine doses are an additional shot which is meant to be delivered for people whose immunity tends to have faded 5 to 6 months after being fully vaccinated. Many countries and medical experts have considered using them to protect people from the risks of deadly COVID-19 variants. In particular, the use of booster shots has been exclusively offered for people who have a higher risk threshold or susceptible to waning immunity due to natural causes such as frontline workers who face a lot of virus risk, people over the age of 65 or those who are above the age of 50 facing significant underlying medical dangers. Who can get booster vaccine? In October 2021, the FDA authorized booster shots of all three vaccines, Pfizer, Moderna, and Johnson & Johnson. For Pfizer and Moderna, the parameters are patients, age 65 and older, age 18 through 64 at high risk or severe COVID-19, age 18 through 64 whose frequent institutional or occupational exposure to SARS-CoV-2 puts them at high risk of serious complications of COVID-19, including severe COVID-19. Additionally, the Johnson & Johnson vaccine booster was cleared for all recipients aged 18 and above who received a single dose of that vaccine. The FDA is also allowing a mix and match system for boosters. In other words, once you've completed your original vaccine dose, you can receive any of the available vaccines as a booster. The Pfizer, BioNTech, and Moderna COVID-19 vaccine may be administered at least 6 months after completion of the primary series of vaccination. The use of a single booster dose of Johnson & Johnson COVID-19 vaccine may be administered at least 2 months after completion of the single-dose primary regimen for individuals 18 years of age and older. What is a third dose of the coronavirus vaccine? A third dose of the mRNA COVID-19 vaccines, Pfizer or Moderna, is identical to the first 2 doses. It can help protect people with weakened immune systems who does not have strong enough response to the first 2 doses of one of the mRNA vaccines. Such people can get a third dose as soon as 28 days after a second dose. In contrast to booster shots, third doses work a bit differently. A third dose of the COVID-19 vaccine is exclusively meant for people who are unable to mount a properly sufficient immune response in the first place or are severely immunocompromised, which could make original vaccinations less effective. Experts say that offering such beneficiaries a third dose could help them match up an immune response similar to generalized healthy populations. Who can get a third dose of a COVID-19 vaccine? Based on CDC recommendations, third vaccine doses can be given to people who are considered moderately or severely immunosuppressed. Those would include those who received active cancer treatment for tumors or cancers of the blood, have received an organ transplant and are taking medicine to suppress the immune system, have either had a stem cell transplant within the last 2 years or are taking medicine to suppress the immune system, the people who are diagnosed with HIV, and people who are taking drugs such as high-dose steroids or other medications that may cause severe suppression of the immune system. Why is a third shot of a COVID-19 vaccine needed? The CDC recommends a third dose of the 2-shot vaccines, Pfizer and Moderna, for people with certain health conditions to help further protect them from getting severely ill or dying due to COVID-19. Some people have conditions or take specific medication doses that can cause them to have a decreased immune system. Data suggests that 2 doses of the mRNA COVID-19 vaccine may not have a strong enough response in these individuals and that they may benefit from a third dose. Are there differences in their usage? Booster shots and third COVID-19 vaccine doses may help people scale up immune response against the pathogen to mark them safe. However, there are notable differences between the two. While a third COVID dose would be a full dose of the vaccine, booster shots being offered right now have a lesser volume or the vaccine injection, since the additional dose is only supposed to increase the efficacy range. Experts have also suggested that there could be some differences in the side effects one could expect. With booster shots, we have come to know about a higher intensity or symptoms similar to what one may go through with the second dose. It's yet unknown how severe or safe a third dose could be. How soon can these shots be administered? While booster shots are subjected to be used 6 months after original vaccination schedules, since it is taken to be time when vaccine-driven antibodies start to wane, for those who are eligible for third COVID vaccination doses, a suitable dose could be offered in a shorter interval of time, usually after the 28-day period. Can additional vaccinations help decreasing COVID-19 risks? While we are currently observing a decreasing of COVID-19 cases in places where there are high caseloads before, it's also being considered to be a positive sign of the vaccines working well again. Again, with no level of surety as to what the future may hold or what the pandemic may or may not look like. Additional vaccine doses or being fully vaccinated right now is the only means by which we can cut down the risks of hospitalization, severe illness, and transmission of COVID-19. If more and more people around us get vaccinated and immunity levels maintain over time, there would possibly be a little scope for the virus to continue transmitting and may have become routine like the flu. Will boosters better protect against Delta or other variants? Researchers say the current vaccines appear to work well against variants of concern that have emerged so far, yet they might not work as strongly against newer variants as they do against earlier ones. For that reason, people might want booster shots to ensure that they get the fullest level of protection against possible variants, and they would want a third shot if any variants emerge that prove better able to evade current vaccines. Drug makers are working on shots targeting variants. I've been vaccinated and had COVID-19. Does a booster shot make sense for me? People who both had COVID-19 and are vaccinated don't need to rush to get the boosters. Several studies suggest that people who have had COVID-19 and were fully vaccinated have strong protection, including against variants, and probably don't need the boost. Such research is preliminary and data is incomplete. Can I get the flu vaccine and a COVID-19 booster shot at the same time? The CDC says that flu shots and COVID-19 vaccines can be given together. It also recommends that everyone aged 6 months and older receive a flu shot by the end of October to November because flu activity peaks December through February. Health experts have warned that the coming flu season is on track to be worse than the last cycle as COVID-19 restrictions that also help prevent the spread of the flu virus are eased.